Bismillahirrahmanirrahim. Assalamu alaikum students. Hope so you are good, fine and healthy, and just keep doing work hard. Inshallah, together we will cover this difficult time with the proper utilization. And I'm very happy for your efforts and your hard working. Just keep it up. Very good. Now, it is like that. Today we are going to discuss about the antibiotic. Like students, if you have any query, then do comment me so that I can solve it. As well as we are also discussing them in the class, but still. It is like that. What is an antibiotic? Basically, antibiotic, as the name is indicating, anti. Do you know the meaning of anti? Anti means against. So anti means against, and what is that? Antibiotic. So biotic, like biotic, you can say that bacteria. So any drug which is working against the bacteria is known as an antibiotic. Now, this drug might kill the bacteria or might it retard the growth of the bacteria. Retard the growth means that it is actually stopping the reproduction of bacteria. These chemicals mostly used to derive from the microorganisms like bacteria or the fungi. Like from where we are getting this kind of the antibiotic? Mostly we are getting these antibiotics from the bacteria plus from the fungi. So there are the two types of the antibiotic, bactericidal and the bacteriostatic antibiotic. Bactericidal. Do you know the meaning of the cidal? The meaning of the cidal is basically to kill. So bactericidal means in which we are killing the bacteria, and the bacteriostatic. Static means stop. So it means that we are stopping the bacterial growth. So this is known as a bacteriostatic. Static means stop. So bacteriostatic and the cidal and the bacteriostatic. The cidal means to kill. So bacteria killing is the bactericidal and the bacteriostatic. Now there are basically three major group of the antibiotics which are actually described in your book. Is the first one is the cephalosporin. Cephalosporin. Now what is basically the cephalosporin? It is basically used to kill the bacteria. This antibiotic is basically the bactericidal. This is basically the bactericidal. This means that used to kill the bacteria. And how it is killing the bacteria? It is basically stopping the bacteria to make its cell wall. So this antibiotic is not actually letting the bacteria to make its cell wall. So that's why the bacteria used to killed. Mostly it is very much common to treat the pneumonia, sore throat, tonsil and the bronchitis. The next example of the antibiotic which is given in your book is the tetracycline. The tetracycline is a very good antibiotic and it is also called the broad spectrum. The broad spectrum. What is the meaning of the broad spectrum? The broad spectrum means that it is killing the broad varieties of the bacteria. It is also a bacteriostatic. It is what? It is a bacteriostatic antibiotic. It is inhibiting the growth of the bacteria because it do not let the tetracycline the bacteria to make the proteins. So obviously when there would be no protein, there would be no growth of the bacteria. It is used to treat the infection of respiratory tract, like pneumonia is also infection of respiratory tract, like common cough, these kind of things, as well as urinary tract infection, as well as intestine. But the tetracycline is not recommended to give to the child who is below to the age of the 8. The reason is that it is also like this kind of antibiotic is also destroying the tooth development. So this kind of antibiotic is not recommended to the child who is below the age of 8. Then the next drug which is discussed here in your book is the sulfur drug. There are many drugs which are actually having the sulfur, so they are known as a sulfur drugs. And the thing which we are going to discuss, the group which we are going to discuss is the sulfonamide. What is that? It means that it is containing the sulfur. What is that? Sulfonamide. So it is containing the sulfur and the amide like amino group. So what is basically this doing? This is basically such kind of the antibiotics which is containing the sulfur group, as well as this is also a broad spectrum drug. This is also what? A broad spectrum drug. And what it is doing, it is basically inhibiting the synthesis of the folic acid. It is inhibiting the synthesis of the folic acid. So the folic acid is not able to what? It is not able to synthesize. So obviously when there is no folic acid, there is no growth of the bacteria. So when there is no growth of the bacteria, it means that the drug is the bacteriostatic. So the MCQs can come accordingly, beta. Is it clear to you? Okay. Now what is like that? But it is not like that the antibiotics are only killing the bacteria, but it is also like that the antibiotics are also getting, like bacteria are getting resistance to the antibiotic. The resistance means that they're no more able to, you can say that, works against the bacteria growth. So it is like that. So students, it is not always happening that bacteria are only killed by the antibiotic, but some bacteria are also causing the resistance against the antibiotic. This means that the antibiotic is not more able to stop the growth or to kill the bacteria. How that come? It is like that when we are using the antibiotic too much frequently, then the bacteria used to get resistance of the antibiotic, and what will happen? One bacteria who is less resistant to the antibiotic will transfer its gene to the other bacteria. So this bacteria will also become resistant to the antibiotic, as well as when this bacteria is going to increase its number. So this is basically this parental bacteria is going to produce that colony of the bacteria which is resistant to the antibiotic. So it is like that. That's why it is recommended that if the doctor is giving you the antibiotic, then complete the course of antibiotic. Otherwise, let's suppose if the doctor is saying to take the antibiotic for 7 days and you are taking for 3 days and you are feeling fine that I'm healthy, and you're not taking it for further 4 days. So what will happen? The bacteria any bacteria who left in your body might get resistance to that antibiotic, and this antibiotic would never work again in your, obviously, on your body. The second reason of the antibiotic resistance is that efficacy. It is like that sometime it used to happen this patient is taking the antibiotic which have zero efficacy against the virus. It means that this antibiotic is not going to work, a zero efficacy, 0% efficacy in the virus. It is not going to kill the virus, but still we are giving this antibiotic, so it also result in the resistance. So resistance in the bacteria is creating a serious problem, because obviously if we are discovering the drugs and then drug after some time is not able to kill the bacteria, so the whole drug is no waste. Obviously the bacteria are taking the resistance of this. So it is very much like, that's why it is likely to said you should have to take the medicine for the recommended time period of the doctor. Hope so beta you get that lecture, and inshallah next time we are going to discuss about the vaccines or the mode of the actions of the vaccines. Be sincere with yourself. I want 100% result from your side. Do work hard, and I know it that if you are going to work hard, you will get the fruit, and just wait for that when you are going to get the fruit. So try your best. Inshallah ta'ala, you will get your fruit. Stay blessed. Allah Hafiz.